We are going to be giving meds now. I have already assessed my patient. I have taken vital signs. I have assessed the need for any PRN medications that they might want. And I am coming to the med room. I'm going to wash my hands. And then look at my MAR, making sure that I have the correct patient. Their name and their date of birth are on there and are correct. I'm looking at their allergies to ensure that I'm not giving anything that they might be allergic to. I am looking at the time and determining which of these medications I need to give. Then I will pull the medications from our automated dispenser. Once I have what I need for each medication individually, I'm going to compare it against my MAR. So I'm looking at the name of the medication on the MAR and the med. I'm looking at the dose. I'm checking the expiration date to make sure they are not expired. And I am making sure that the route is correct. Once I have pulled all of my medications, I will grab any supplies that I need. I have already done my first check of my IV push medication at the automated dispensing system. I have now come to a quiet location to do my second check. I am going to look at my MAR and check my patient's name and date of birth, verify their allergies. I need to look at if the patient has primary fluids ordered. If they do, I'm going to check compatibility between my medication and my primary fluids on my compatibility chart. Then I will do my second check of the medication, stating the name of the medication on the MAR and the name of the medication on the vial, the dose of the medication on the MAR and the dose on the vial. The route is IV or IV push, checking that the time is correct and the frequency is correct. Now I will pull out my drug cards so that I can do my calculations. You should have on your drug cards how fast you are able to give the medication. This medication I will be giving 1 milliliter over 1 minute. I'm going to go ahead and wash my hands and draw up my med. Take off the dust cap. Clean vigorously for 15 seconds. While that dries, I will get my syringe and my needle ready, maintaining sterility the whole time I'm opening these. Going to add 1 milliliter of air to my syringe. Go right through the center and inject the air into the air in the vial. And flipping it over, making sure not to touch the barrel. And get all of those little air bubbles out. I have 1 milliliter of medication. Carefully using a one-handed scoop, I will recap my needle. And then label it with the patient's initials, the drug name, the dose in milligrams, and the date and time. Making sure to keep the numbers visible on here. And I'm ready to go to my patient's room. I have knocked on the door and come into my patient's room. I've introduced myself and told the patient that we are giving an IV push medication. I'm going to wash my hands and identify my patient. Can you tell me your name and date of birth? Okay, and do you have any allergies? Okay. How does this IV feel? I'm going to assess for inflammation or phlebitis, looking for any warmth, redness, swelling. It feels fine? Okay, great. And I'm going to pull out my drug cards and explain to the patient what medication they're getting, what it's for, and what the possible side effects would be. Then I will do my third check of the medication. I need to make sure that the fluids I have running are the fluids that I have on my MAR. So I will compare my MAR, the name of the fluids, against the name of the fluids on the bag. Then I will do my third check on our medication, reading out the name of the medication on the MAR, the name on the vial, the dose of the medication on the MAR, the dose of the vial. The route is IV or IV push. We have the correct frequency, and it is an appropriate time to be giving this medication. Check your hospital policy to determine if you need gloves for this step. We are going to clean the port closest to your patient's IV site for 15 seconds vigorously. And keeping this in your hand, make sure not to drop it so you maintain your sterility. Take the needle off of your medication. And attach it. Making sure you can see the numbers. And we are going to give the medication in quarters, so 1/4 of it every 15 seconds. So go ahead and pinch. I'm giving 0.25 milliliters and then waiting for 15 seconds to elapse, and I can let that go while I wait. And then pinch, give 0.25 milliliters again. And wait for 15 seconds to elapse. Pinch. Another quarter has been given. And the rest will go in. And let it go. Maintaining your hold on the tubing. We will switch to our flush. Make sure you have gotten enough out so that you're on a line so you know where you're starting. And you should be flushing the first milliliter at the same rate that your medication went in. Once that first milliliter has been pushed at the same rate, you can slowly push the rest, or at least 3 milliliters. Assess how your patient feels. Make sure that that IV site still feels fine. There's no signs of inflammation or phlebitis. Wash your hands and document. I will now show you what to do if your primary fluids are incompatible with your medication. First, you will clean the site closest to the patient after fully clamping your primary fluids. For at least 15 seconds vigorously. Keeping a hold on that so you don't lose sterility. Go ahead and flush with a full 10 milliliters. Slowly, but there's no time frame for this one. Then we'll switch to our medication syringe. You'll be pinching the whole time you're giving this medication. So you go ahead and give the allotted med amount over your 15 seconds, wait 15 seconds, and then continue to give the medication over the allotted time. Once it is all in, you will flush with another 10 milliliters of normal saline. Keeping that tubing clamped the whole time. The first milliliter of this flush should be at the same rate as your medication was given. And once you do that, you can flush the rest of the 10 milliliters. Then you can unclamp and reset your primary fluids. This is what you will do if you have no IV fluids running and you just have an IV lock, which can also be called a PRN adapter, a saline lock, or a HEP lock. First, we will clean the port. For 15 seconds vigorously. Then we will do a pre-flush. This is to ensure that your IV is patent, it's working, it's not infiltrated, there's no phlebitis. You'll push at least 3 milliliters at a slow rate. You will then switch to your medication syringe. Pushing the medication at the appropriate rate determined by your drug cards or the med book. Once that is all in, you will do a post flush with the first milliliter at the same rate that you gave your medications. And then at least 3 milliliters after that. make sure to clamp your IV. And that's it.